I'm Tanya Lowry St. John with the Hawaii Health Data Warehouse, or HHDW, at the University of Hawaii, Manoa. We're going to use the next 30 minutes to introduce you to the Cancer Plan 2030 Tracker in Hawaii Health Matters, or HHM. The presentation and demo should take about 20 minutes, and then we'll have a few minutes left for an activity and questions so that we finish up in half an hour. The Comprehensive Cancer Control Program in the Hawaii Department of Health's Chronic Disease Prevention and Health Promotion Division has been creating data books and strategic plans to guide their work for many years. These were typically 5-year steering documents, with the last version published in 2016. Each new version has sought to combine the latest data with the newest technology to present the most current information in an easy-to-use manner. To that end, the program has commissioned an online data tracker for the Hawaii Cancer Plan 2030. This is their first tracker, and this tracker can be used by many different stakeholders, including researchers and students, public health professionals, policymakers, educators, media, grant writers, community members, and advocates. But the 2030 Cancer Plan is also part of something bigger. The Chronic Disease Prevention and Health Promotion Division at DOH set an ambitious goal to create an overarching plan to harmonize the division's 2030 goals into the Healthy Hawaii Strategic Plan. The strategic plan includes program-specific plans for asthma, cancer, diabetes, heart disease and stroke, physical activity and nutrition, and tobacco prevention and control, with work across the plans in the following sector areas: community design and access, education, healthcare, and worksite. The Cancer Plan 2030 Tracker provides a convenient tool to monitor the state's progress towards the 2030 plan and the ultimate vision of no more cancer. The tracker contains about 40 cancer-related indicators of population health from multiple sources, including the Behavior Risk Factor Surveillance System, the Youth Risk Behavior Survey, the National Cancer Institute, CDC Places, Vital Statistics, and Claritas Consumer Profiles. The data is divided into sections by the types of cancer and in accordance with the Cancer Plan focus areas of eliminating cancer disparities, prevention, early detection, treatment, and survivorship. The tracker features a toggle control to let you easily see the data by state and county level, trend data, subgroup breakout data such as by sex and race, ethnicity, and others where available, icons to highlight comparison data and directionality, interactive maps and charts, and links to related data. As with all of our systems, the data is updated asynchronously by source. We created several new indicators in HHM for the 2030 tracker, and you can see the complete list here. We've added indicators in the area of prevention, of screening, and then of treatment, and then also for the area of survivorship. Two of the guiding principles in the HHM site are to provide data in context so you have something to compare it to and to make the data easy to understand. We do this using a collection of symbols and visual cues throughout the site. Up and down arrows are paired with colors. So the color red is bad or moving in the wrong direction, green is good or moving in the desired direction, and blue is neutral. For symbols, solid boxes show statistically significant trends, and mostly white boxes are not statistically significant. A green check means a target has been met, and a red X means it has not been met. So let's work through an example. Here you can see that there were 22.5 lung cancer deaths per 100,000 people in Hawaii in 2020. This is significantly lower than the US value, and lung cancer deaths have decreased significantly over time. As a state, we have already met the Healthy People 2030 target. But the Cancer Plan target is more ambitious, and it's based on our state baseline, so we have not met that target yet of 20.3 per 100,000. So then let's go ahead and explore the system. To get to the tracker, you can start at our website, hhdw.org, and click here on Go to Hawaii Health Matters. You can also enter hawaiihealthmatters.org into your browser. And you'll see here that the Hawaii Cancer Plan 2030 tracker is the featured content for this month. Scrolling down, you can see our focus on for this month, which is related to our featured content, is the Cancer Plan tracker. So you can click here to get there. You can click Find Out More. You can get a little bit of an overview of some of the highlights of the tracker here as well. So you will know when you come back in January, since this is our December featured content, things will look a little bit different. You will also be able to always find the tracker here under Community Dashboard. You'll go here, you can see we can search by keywords and then all of our trackers in the system. Here you see the Cancer Plan 2030 tracker. You can also see it under our track progress, the most recent tracker. These are in the order of they were done. So the most recent one is the Cancer Plan tracker. So you can click here, or you can come to the track progress page and you'll see it here as well. It may move around a little bit on this page over time, but it will always be here. So let's click through. Here you can see our current tracker, and we provide a little bit of information about the tracker and links to the strategic plan, as well as to the executive summary. The data is broken up into overall and then by breast cancer. So as you can see, you can scroll down, you'll see the location is Hawaii, and then there's the topic area, cervical cancer, colorectal cancer, liver cancer, lung and oral cancer, prostate cancer, skin cancer, and then our survivorship indicators. So for each indicator, you can see the point prevalence, the year of the measurement, and comparison data. So here at the melanoma cancer death rate, you can see it was last measured in 2016 to 2020. We are lower than the US value overall. You can see that it has decreased over time, but not significantly, since that's mostly white. And by contrast here, the melanoma incident rate, we're 22.9 per 100,000. That was measured in 2014 to 2018. We are slightly higher than the US value. This has increased significantly over time, and in neither of these two have we met the target, which makes sense. We've just set the baseline and we're setting our goal for the next 8 years as we get to the 2030. If you are looking at the indicators and the icons and you're trying to remember what they mean, you can always click here on the See Legend on the side. This will be available for you on the left-hand side of your screen, which will have an explanation again of the icons that you see. And now we're going to go back up to the top by clicking here on the orange arrow. And I want to draw your attention to these controls. These controls here will allow you to view the indicators in a tile set if you prefer this view as opposed to the list view. And then we also have a colorblind mode on and off that will have the thumbs up, thumbs down arrow so you can know whether or not that's good or bad, because the red and the green can be difficult for some folks to see. So you can turn those on and off. Lastly, here what we have is the geography, this control that allows you to change the geography of the tracker. So we're currently looking at the data for the state of Hawaii, but let's say I'm from Maui County and I might be more interested in my local data. I can go ahead and click here and it will refresh. And now the data is available for Maui County. So then I can see, like, my adults who have died of cancer, it's 5.4%, and my comparisons have now changed. So now that's compared to the Hawaii value. And then our trends and so forth are now all related to Maui. As I scroll through here, again, this information that it is Maui County will be available, and then the subsection of information that is available through there. So it's a neat way to go through all of this data, and this current system is available for the state and county, and there are some that even have sub-county level data. So let's take a closer look at one of the indicators here in the system. So we're going to take a look here at the colorectal cancer screening information. So we're going to click on the title, and this will bring you to the standard report. In each of our standard reports, you're going to find first the title of the indicator, and then you'll have this information here, which tells you the geography you're in and the time period. So you'll see we've been collecting this data for some time, so you can go back and look at a specific year. In this case, I'm going to switch us back to the state of Hawaii, just so that we're looking at overall as we scroll through some other pieces. The next, you're going to find the definition of the indicator. When we're looking at the screenings, we generally use the U.S. Preventive Task Force latest definition. Colorectal cancer is going to be one that will change a little bit because they've updated the definition, and we're still updating all of our surveillance systems, but this was the most updated information we have at this time on this kind of screening. And so here you have the definition of what it is, and then we hear information about why it is important. You can see that this is actually a Healthy People 2030 leading health indicator. Scrolling down, you can see this point prevalence of 77.1%. You can see the data source and then the year. And you have this icons again to give you that context. Is 77.1 good or bad? If you don't remember how to interpret those icons, again, you can do the See Legend. And this view in the Health Indicator Report view, you can mouse over them and it will give you the information underneath to let you interpret what you're looking at. So scrolling down, we have our line graph, which shows you how this has changed over time. And you can go ahead and also see that we have breakout data, which is the view by subgroup. If you hover over any of the objects here, you'll get the underlying data. Another way that you can get this information is if you click on these three bars, which we affectionately call the hamburger, and you can use those whenever you see them. You can click there to adjust some properties of the chart. So for example, here I can go ahead and I'm going to show confidence intervals, but you can also see you can download it as a JPEG, a PDF, or the underlying data in a CSV file so that we can then see this, for example, over time. You can go ahead over here and view our data by subgroup. So clicking on all of these will open them up. And you can see again that red is significantly worse. So it says it over here. And remember, that's just our rubric. Red is bad and green is good. So red is significantly worse than the state is overall, and green is significantly better. So here we can see that colorectal cancer screening is significantly higher among adults who are retired or unable to work, but it is significantly lower among adults who did not graduate high school, those who are unemployed, and those who are at 0 to 130% of federal poverty level. So if you're interested in working in this area, automatically you know some groups that have disparities. And of course, reducing cancer disparities is part of the plan. So scrolling down, we're going to explore the geography function of the system. And so for this indicator, you can see that data is available by state, by county, census place and city, zip codes, and census tract. The state and county information is from our behavioral risk factor surveillance system, and the CDC Places provides the census and the zip code and the census tract. They take our state data and they reweight it entirely to be able to get to really granular level. So let's take a look at the county data. So here in the geography grouping, you will see that the data is available here in a map, in a chart, and also in a table. And as if you hover over one, the focus will appear in the other two. So it's a neat way to be able to look at them. Whenever you see these little arrows in the system, that means that you can do some work there. So you can sort them if you want and so forth. And again, for that comparison, you can go ahead and look and see how our data you can compare to the Hawaii, to the state and territories. But here, since we're talking about the cancer plan, we'll compare and we'll see that none of our counties have met our current goals for colorectal cancer screening. So this is a neat tool that you can use to look at your indicators by geography. And then the final part of the data in context in our system is that each indicator is displayed with related content, which includes indicators, reports, data sources, fact sheets, websites, plans. So you can see here that this is going to be related if you want to see the cancer state plan and the executive summary are right here as well. So all of that are here within our system, and we associate them. We can load content into the platform and associate them to health indicators via keywords. So if you have content that you are interested in getting out there that would be helpful to folks as they're understanding different areas of cancer, you can let us know and we can look at adding them to our resource library. But it's a pretty extensive in here, and as you can see, many of these have more. So for example, if I click on here, you'll generally have 3 display, but there's a lot of other in the system that can be related to your topic area. So you can spend a lot of time once you define what you're interested in, going down and seeing what's related to it. And if this information in terms of looking at our cancer data for colorectal screening is not quite enough for you, or you want to view it a different way, so perhaps you want to do your own analysis and look at this data by age and sex, or by race, ethnicity, county, for example, actually that will already be there, but by some different things, then you can, for our indicators that data is housed within the Hawaii Health Data Warehouse, such as our behavioral risk factor surveillance system data, you can click here on the data source. You see the little out arrow that tells you you'll be going to a new website. And this will bring you actually to our build your own query function in HHDW. And it is the colorectal screening. And so you can go ahead and modify the query so you can aggregate multiple years if you need to get down to a smaller area and so forth. So that is available to you right out of the system. And so this will allow you to run real-time queries on an underlying BRFSS data set. So you have a lot of power there. This is a fixed view that we have here. Okay, so we will come back up here to the cancer plan, and I'm going to give you some time to go through and look at a hands-on activity. So you can open up your browsers. If you haven't already, I hope you've been clicking along and see if you can use the cancer plan to answer the following questions. What is the U.S. Preventive Health Services Task Force recommendation for cervical cancer screening? And so remember, look at the indicator definition. The next question is what percent of women met the recommendations in 2020? Who was most likely to be screened or most at risk for not being screened by subgroup? And then the same question by geography. And then my next question for you is what percent of 18 to 26-year-olds in Hawaii County have been vaccinated for HPV? So the first question is, what is the recommendation for cervical cancer screening? So scrolling down here, coming to cervical cancer, and the system is set up according to the program specifications to cover incidence, then death, and then screening, and then prevention afterwards. So here we have the cervical cancer screening. So here we have the definition here is women who are aged of 21 to 65 who have been screened for cervical cancer. Women aged 21 through 29 should get a Pap test every 3 years, and women aged 30 through 65 should get a Pap test every 3 years or an HPV test every 5 years, and a co-test is also acceptable for these. You'll notice in the tracker, we actually have this as a whole, and then the two separate versions of them, so depending on the focus of the population that you're interested in looking at. So, and then the next question is, what percent of women met the recommendations? That's 80.2%. Who was the group most likely to, most at risk for not being screened or being screened by subgroups? And you can take a look here and you can see, so most likely to be screened would be women with a bachelor's degree or higher, those with 186% or plus of poverty level, and the least likely to be screened are those who with 0 to 130% of federal poverty level. The screening here, this is another one that I found was really interesting when you look at the difference for LGBTQ, it's 69.4%, which is very close to the 69.7% for the women with 0 to 100% of federal poverty level. The issue here is going to be sample size because our confidence intervals overlap. So this would be a great place if you wanted to go forth and take a look and go back up here and go into the behavioral risk factor surveillance system, aggregate multiple years and see to investigate whether or not that's statistically different. You can come down here and look at the data then by counties and then by the zip codes and the census tract. And you can see there is a slight difference by counties if you wanted to see whether or not that's statistically significant. You can show that confidence intervals. It's something we talked about at the coffee break last month. And then you can go ahead and look at the data by zip codes. And then as you'll see, they're going to be sorted lowest to highest here. And then so you can see that with the lowest screening rate is going to be 75% here. It's just a zip code on the Big Island. And then you can take a look and say the highest screening rate is 90.3. And when you go in and you really focus in on this one, you'll discover that this is actually a small zip code within the Marine Corps base Kaneohe. So that might not be an area that you're going to focus on, so you can kind of take a look elsewhere. And you can go down and do that same process here by census tract. And you'll be able to see that from there, the ranges are 70.5% from a low by census tract here. And again, you can see where that is, and you can also sort it and then go see there where your highest census tract is as well. So you can zoom in on the islands to see where those are, and those both actually are here on Oahu. Okay, and then the next question is what percentage of 18 to 26-year-olds in Hawaii County have been vaccinated for HPV? And to discover that, we're going to come up here, change our toggle to Hawaii County. And so now the point prevalence that you're going to see here are all going to be related to Hawaii County. And we're going to come down to the cervical cancer area and adults with HPV vaccine. So you can see this is our indicator. We know we're here in Hawaii County, and it's 31.5%. And I wanted to invite you to join us next year and next month on Tuesday, January 10th. And we'll be doing the build and share custom dashboards in hawaiihealthmatters.org. So that's a neat functionality that may be very helpful to you in terms of just building what you want to look at. You can save that URL and use it over and over again. And then remind you in February, for our February webinar, we are planning to be featuring the 2021 YRBS data. So we're looking forward to that.